Welcome back, folks. This is Consumers Dr. Bengala. Today's topic: don't be a slave to your health insurance. Be a master. That's the topic, folks. I keep coming up with new topics for it so I can make it interesting for all you folks out there, because we take everything for granted. In life, there's nothing you need to take it, especially when it comes to health insurance. My strong advice is be a master. Never be a slave to a health insurance man, because health insurance is not your friend. They're trying to make money off of you. I'll give you the tips how to be a master for their health insurance. Yes, very important. Yes, a lot of folks out don't know how to be a master. Okay, first, number one rule, never buy a traditional health insurance. Traditional health insurance makes you lazy, makes you dependent. Every time you go to see a doctor, you just give it away. You don't care. You really don't care how much they bill the insurance. You don't care what it is. It doesn't matter to you, because even though they are raising your health insurance premium every year because you're using too much, go for it. If you're not concerned about it, go for it, folks. But that's not the right way to do it. I want you to take charge on your health insurance and on your health, and come out ahead in financing, especially your finances. Health insurance is one of the places where you're making lots of money, folks. Lots of money. A lot of people don't understand that. Why do you want to give money away to the insurers where they want to make profits on Wall Street? I will never do that. Even though it doesn't matter to me how much money I have or you have. It doesn't matter. But still, you need to be a master. Now, that's number one. Don't buy traditional health insurance. And number two, always buy a deductible health policy. There are lots of employers out there. They're still giving traditional health insurance to their employees. I feel like, employers need to be educated, because if they want their employees to be loyal to them, folks, employers, message is for the employers. If your employees want to be loyal to your company, better get a deductible. You pay for the deductible, but you lower their premium and save money. As an employer, you can save money getting a deductible policy for your employees. It doesn't matter, 50, under 50, over 50, small, large. Especially, this is for the mom and pop, small businesses. That's where most of the uninsured are. So if you have a restaurant, if you have a doctor's office, or if you have under 50 employees, buy them a deductible policy, lower the premium, and let you chip in if they use that insurance card. So that's where you come out ahead by getting a deductible health policy. If you have a 34-year-old employee, all of them are healthy, they don't get to see a doctor, they don't have any medical issues, employers will come out ahead by getting a deductible policy. It should not be more than $50 a month, folks. $50 a month. And that gives because your employee knows that you're paying the deductible, and he'll be careful to watch out. If you're paying the deductible, he'll be careful not to abuse the insurance. Even for employers, it's a good policy. So nobody should abuse the health insurance. Just because you have it, you need to use it. But if somebody's paying from the pocket, you'll be careful. So always buy a deductible, depending on your affordability, folks. It's very simple as that, even for both the employers and employees. Affordability factor is very important. And number three, this is where you make lots of money, folks. I'm not kidding. Health savings accounts. Employers out there, go to the dollarcare.org. Go to service section Employers, you can sign up. Employees, individuals, you can sign up. As a family, you can sign up. For an individual, $10 a day, $300 a month, $3,600 a year. For a family, $20 a day, $600 a month, $7,200 a year. Every year, man, every year. For employers, you can do the same. You can contribute half, they can contribute. Whatever the money you're saving in your deductible, contributed to their health savings. Employees will love you. They will adore you. They think you're a Superman. Whatever money you're saving in your deductible policy, put that money back into the health savings. That's the beauty, folks. So never be a slave to health insurance. It's a very big thing, folks. A lot of people out there, the reason why the healthcare costs keeps rising because insurance companies are not interested in lowering the cost. Only you can lower the cost. You as an employer and employee can lower the cost by getting a deductible health, because once you have a deductible, you have to pay, somebody has to pay from their pocket. That disincentivizes to use the healthcare just like that. And if you have a healthcare issue, ask Siri, ask Google, ask Alexa, hey, I have a headache, I have a backache. What should I do? Half your problems are solved with your mobile phone. Yes, mobile phone. I'm not kidding, man. That's your best information you can get. Ask Siri, I have a backache, I have my knees hurting, my joints are hurting. What should I do? Siri will give you 100 different diagnoses, and you can pinpoint and see where the problem is, and you can take care of yourself without seeing a doctor. Did you get that, folks? And health savings. Once you start putting $3,600 or $7,200 year after year, at the end of 10 years, that $36,000 will be $50,000, because you're putting money in the Ameritrade brokerage. You're leaving a couple of thousand in your HSA bank and putting in the rest of it in the Ameritrade. And it'll be tied to an index fund, NASDAQ index, you name it, folks. That's how you come out ahead year after year. And by the time you retire, folks, you don't need to worry about your health. You don't need a managed care. You don't need... Actually, you may not even need supplemental, because you're careful about what you do. And I would save money every penny I can. This is how we need to take care of our health. And when you have that kind of money in your bank, you'll be careful with your health. You'll take care of it. You'll do exercise. You'll lose weight. Obesity has been the number one problem, folks, and mental disorders. Most of the things can be solved on your mobile. Your information is on your mobile phone. So mobile healthcoverage.com or mobilehealthinsuranceplan.com, dollarcare.org, place for care. Point of care is another one. Point of care, you know what the place of care is going to be? Your home. You don't need to go to the hospital. You don't need to go to the doctor's office. I would like to see doctors making house calls, and you pay as you go. That's the beauty, folks. If you like this channel, subscribe, share, make some comments, and please support the channel by voluntary contribution. This is a non-profit organization, purely voluntary organization. You can, when you go to the dollarcare.org, you can make $10, $15, whatever they contribute. I would really appreciate that. And follow me, folks. As a consumer's doctor, I will help every way I can to take care of yourself and be healthy. God bless you. Goodbye.